most people want to feel accepted, connected, loved, and you see it all the time. Is when you're alone, it's more stressful, because everybody needs some alone time, right? But it's more stressful, and that they've proven now they're doing the work with what they call neuropsychoimmunology, basically the nervous system, the immune system, and the psychological system, how they all work together. That community and support decreases stress, which decreases pain, and chronic pain and disease is linked to incessant stress.
Yeah.
And the more I do this work, there's two things I want to go back on. One is that people ask me, okay, doc, if I'm doing like a crawling pattern, should my pelvis be in anterior tilt or posterior tilt or neutral? And my answer is yes, which means I want you to be able to crawl in all of those positions, not just one. And I tell people, I want you to find the position that you feel most comfortable in first, whether it's clinically right or wrong, because there is no right or wrong to me. There's just different. So I'm going to put you where you want to move first, right? Then I'm going to take you into the other extremes of where you don't want to go. And I'm going to explore that parameter. Because in real life, trust me, when you go to pick up your grocery bag or pick up your kid or reflexively move when something's coming at you, your pelvis has to go wherever it wants to go, because you're not going to say, all right, there's a ball coming at me. I got a posterior pelvic tilt and engage my transverse abdominis and externally rotate my hip. It doesn't work like that.
No.
And what I like about Porges' work is that primal brain, that mammalian brain, the thinking brain versus the survival brain. When you look at movement, only 10% of the brain is devoted to voluntary movement. 10%. So that means I'm going to think about picking up, let's say I'm going to think about picking up a ball in front of me.
Yeah.
10% of that is voluntary conscious movement. The other 90% is reflexive, which means it happens without you having to think about it. So in my work, the key to restoration is not the voluntary part. No. It's the reflexive part. And guess what drives the reflexive part? Not the front, not the thinking brain, right? So we as humans, because we can think, we think we know it all. You don't know anything. Right? No. What's driving it is the one in the back that says, how about we don't die today? That'd be a really nice day for me.